All right, this is chapter 21, Skin and Eye Infections, part 3. Last one. We can see that there are 3 kinds of fungal infections of the skin we're going to talk about. We'll start with our dermatophytes. Notice that the dermatophytes, also called tinnias, this is kind of like an overall general term for fungal infections of the skin. The actual species that causes them are here. Okay, so there's trichophyton, epidermophyton, and microsporum. So let's take a look at these skin infections. Dermatophytes, okay, so derma refers to the dermis. Oops, sorry about that. Thought I had my... Okay, so dermatophytes, right? Derma refers to the dermis of skin, although these are going to be more topical. So cutaneous is going to just be that epidermis, and really it's, that upper sort of dead area. So it's restricted to our non-living skin, right? That very, very top layer, very superficial. And it can infect the skin, it can infect hair, and also nails. So all of these guys are made of keratin. That upper layer of skin is keratin, our hair is made of keratin, our nails are made of keratin. So what these guys do is they digest keratin, right? They like to eat it, source of food for them. And so they can, this kind of infection can be anywhere on the body. So you can see that they're named after where the body is. So tinea capitis would be on the head. And you can see that the hair follicles are being impacted here. If it's really, really deep and inflammatory, you can lose the hair permanently. So hopefully it doesn't get that way on this person here. Athlete's foot, bottom of the feet, and then tinea corporis is the reason why this is also called ringworm, is because it tends to grow in a circle, but it's not a worm, right? But just the name. So where do we find these guys? They are commonly found in the environment, the soils, and anywhere that's going to be exposed to the skin. You can also get it from other people, so it is communicable. You can get fungal infections from other humans. You can also get them from our furry friends. You can also get them from spores that spread in the air. So we're talking about fungus. Fungus is basically all around us. And dermatophytes like moist, dark environments. So the more moist the air of your body is, the better for fungal growth. You want to make sure that if you are in a gym or any sort of public area where you do not wear shoes, you want to make sure your feet are clean and dry before you put your shoes on, because that can limit the chances of you getting like athlete's foot or anything like that. You can also get cutaneous dermatophytes by sharing personal articles, towels, for example, public facilities like gyms, swimming pools, and then also your animals. Sexual contact, yes, you can get fungal infections that way, and also mother to child in childbirth. Luckily, treatment for dermatophytoses is pretty over-the-counter and common. So a lot of the therapies here is going to, because it is so shallow, right? Because the fungus is on that dead layer, we know that that dead layer of skin is going to come off every day. So some of these drugs work by just speeding up the sloughing off of your tissue. And so when that happens, so I'm talking about this. So some drugs work by speeding off the sloughing off of skin. That can cause your skin to get really dry, which is one sort of side effect of these skin treatments. So if some of them might stop the multiplication, right? Because if the fungus stops multiplying, it's going to eventually come off your skin anyway with your skin or nail or your hair. And so the most common and most satisfactory treatment is going to be your topical antifungals. This is Candida. This is our friend Candida albicans. We know this because we've talked about Candida a lot before. It's a normal flora yeast and fungus, and it can overgrow. It's found on our skin, also found in our mucous membranes. The 2 places of note is mouth and vagina, where it causes a lot of candidiasis. So any overgrowth of this candida is called candidiasis. All right, so the most common ones are vulvovaginal, which is basically what women would call a yeast infection. Thrush is going to be in the mouth, basically the same thing, but in the mouth, and these are covered in other chapters. The one that we're talking about here is on the skin. So we can see how it manifests on the skin. It looks very painful, very red. And basically, you want to keep it contained because it can spread. It can cause pneumonia, septicemia, that means it's in the bloodstream, or endocarditis, meaning it went to the heart. In immunocompromised patients. Okay, so Candida usually it's not a problem for healthy people. It might cause an infection now and then, right? Either yeast infection or thrush, but it's treatable. If you have a debilitated immune system, Candida becomes a real issue and it becomes deadly even. So it's transmissible and it's treated with azoles. So I mentioned azoles here because a lot of the antifungals will end in like miconazole, right? That's an azole. But yeah, so that's basically it. So over-the-counter antifungals will have the suffix azoles, and to sort of not get candidiasis, right? We want to avoid excessive moisture, maintain good health, good practices of washing, right? Good hygiene, and having appropriate clothing, meaning things that are wet should come off your body instead of just sort of like leaving a bathing suit on. Or you can see here where the diaper should go is where the Candida has had an infection. All right, so this is other places where you can get these Candida infections. This is going to be a rash on the skin. This is going to be an image of a nail. So it's called Tinea unguium, which is a fun word to say. And they can be caused by other dermatophytes or Candida. So both of these, obviously. But this is relatively common in nails among adults, and especially those that if you wear like fake nails or something on top of your real nail, that's an environment that is going to be closed. It's going to be warm, dark, and if you have an overgrowth there, it's more common in people who have something on top of their nails. All right, so you can get fungal nails from nail polish and nail salons. Yes. Okay, so something to think about, and that's why nail salons are so tightly regulated with their equipment. They have to go into that disinfectant. But really interesting that I did not know actually that they can actually grow in some of our nail polishes. And so we want to make sure that our where you get a mani-pedi is clean. And acrylic nails protects against nail fungus is incorrect. It actually is going to be worse for the nails in harboring the candidiasis. Our next fungal infection here is called sporotrichosis. And I love saying this, Sporothrix shankai. All right, so Sporothrix shankai is the species. It's commonly known as rose gardener's disease because it is in the soil. And when you work with roses, they have thorns, and those thorns will push the fungus into your skin. It is normally a decomposer, so it has a role in the environment to decompose organic molecules. So transmission, I mentioned, right? You just get a cut, prick your finger, and it comes into your skin. It grows at the site of penetration, and it can develop a small ulcer. You can also have hard nodules, which are bumps. If the nodule gets bigger, it can become necrotic, break through the skin surface, and that, obviously any necrosis is really bad news. Any necrosis is very, very serious. And another hallmark of this disease, right, the hallmark of our sporotrichosis is the following of the lymphatic vessel. So our lymph channels, our lymphatic vessels, run right along our blood vessels. They are a little bit more open wide to larger microbes. So fungi, if you remember, are eukaryotic. The cells of fungi are like 1,000 times bigger than a bacteria. So they tend to not enter the bloodstream from a cut because the blood vessels we have are prevent really large cells from getting in. However, our lymphatic channels are not. They are more porous and have open flaps that allow really big things like fungal cells to get in, yeast cells to get in. And so that's why we see this sort of linear track of the infection. Here are some other images of the sporotrichosis, so you can see just the different ways it manifests. And it's rarely fatal. It is treatable, but untreated, it can just stay in your body for a long time. All right, so here is our mycoses. We did not talk about aspergillus, but we did talk about candidiasis and sporotrichosis in our tinnias. Lastly, we have our parasite here. We only have one to speak of. It's Acanthamoeba, and Acanthamoeba causes eye infection. So this is a waterborne parasite. Okay, it's very common in unchlorinated aqueous environments. So this is going to be your lakes, your streams, your sort of the hot springs kind of thing. And so if you let's follow this along, right? So we have our cysts that are in the water. If you go swimming and you get unlucky and this thing enters your eye, it can enter your skin. It can also affect your central nervous system if it gets into your bloodstream. But what tends to happen is that you'll get it into your nose or your eye. And if it enters through the eye, it can involve severe keratitis. Remember, that's the cornea, right? So that's just the outer surface of your eye. It's going to stay on the outside and just cause that infection of the cornea. It does not go inside. If it goes through your nose, right, then it can become disseminated, meaning that it can spread into the bloodstream. And in broken skin, it can also become disseminated in the bloodstream. However, there's treatment, but the most common kind is going to be your keratitis. And this is what the keratitis looks like. It looks very severe as well. I keep saying the word severe in this one. While Acanthamoeba keratitis is mild, it can lead to several severe corneal damage, visual impairment, and even blindness. The keratitis infection here can also be involved other things, right, such as Pseudomonas. And Acanthamoeba, if you can imagine, if you are in a natural water, you have contact lenses in, those contact lenses can trap the amoeba between the contact lens and your eye, and then the amoeba can sort of thrive in that space, and then it causes disease more easily. This is not communicable, thank goodness, all right, and it enters your body with contact with the waters. And so this is the only one we're talking about, Acanthamoeba. We're not going to cover the Loa Loa. And that's it for today.